Hi, Kevin Henry, the Group Editorial Director for Advanstar, and I'm on a Google Hangout today with our esteemed technology editor, Dr. John Flucke. And
Okay.
I'm going to ask you for that look behind the curtain, as it were, into your dental practice. How do you stay HIPAA compliant in your practice?
Well, I'll tell you, there's a lot of research that's done. We do a lot of looking at online. We try and stay current with with the manufacturers of the software and talk to those people and that sort of thing. HIPAA this year, I think one of the big things that we as dentists and as dentistry are battling is, we didn't sell out like medicine did, and I don't mean that really in a bad way. I'm not trying to talk negative about our medical colleagues, but a lot of physicians had their practices purchased by huge healthcare conglomerates, and having those kind of people behind you with the financial resources of pooling multiple hospitals together, that helps you from a financial standpoint. And so when it's time for HIPAA compliance, a lot of our medical colleagues actually have, just like a big company might have an HR department, some of these physicians and hospitals, they have HIPAA compliance departments that help. We don't have that. That's hard, and that requires a lot of research. I do think the ADA has a pretty good manual on HIPAA compliance that we buy. Anytime there's an update, we buy the new update and go over it. We do at least one HIPAA compliance meeting a year, sometimes more than that, to just talk about it and make sure that we're following up and doing what we should. The biggest thing that I see right now in dentistry that is a problem for offices is compliance with email. And the whole email thing is a really big deal, and a lot of us don't even think about the fact that if you sit down and, if I'm referring a patient to a friend of mine who's a periodontist, if I simply take and send an email with a bite wing and a PA and a little bit of information on it, suddenly that information is confidential. And when you hit send, people don't really think about it, but the science behind it is, that information gets bounced around from node to node on the internet. There's a reason they call it the World Wide Web, and the idea is, it's like a spider's web. There's lots of interconnected points, and your email may hit, multiple servers out there before it actually ends up in the hands of your periodontist, who could be 2 miles down the street. Because of that, I have become a big fan of a company called Aspida. It's ASPIDA, and they do a compliant email system, which is pretty cool. We're going to throw a graphic up here that kind of helps you understand this, but the idea is, to the best of my knowledge, the only way that you can really be HIPAA compliant with email, it's not just having the email encrypted, but it is having the email encrypted and it never leaves the email server. So let me explain to you how this works. The system I use, if I, for instance, let's just pretend, Kevin, that you're my patient. So if you need to have maybe your wisdom teeth extracted, I'm going to send an email to my oral surgeon, and the subject line is going to say Kevin Henry Secure, or patient Kevin Henry Secure. And the word secure in that subject line is going to be picked up by software on the email server, and it's going to encrypt it automatically. The minute it sees the word secure, it's going to encrypt it just like a credit card transaction. What will then happen is my oral surgeon will get an email from me with the subject line Kevin Henry Secure, and there will be a link, and that's all they're going to get is a link. And when they click on that link, the first time they do this, they have to set up a username and a password, but after that, it just happens automatically. But you will go to the server, you'll be logged into the email server, and then you'll have access to my email, and you can see it right there, but it never leaves that server. It never gets bounced around on all these nodes on the web. It stays there, and I know that it's secure because it never leaves that server. And so that's the big thing on the compliance issue of email. But simply sending something to somebody email-wise is not compliance. And I don't think that you would probably sit down and send your credit card via email and say, here's my credit card number, Kevin, go ahead and discharge my credit card. Most people wouldn't do that. If you wouldn't do it with a credit card, you sure as heck shouldn't be doing it with health histories, radiographs, all that stuff. And so one of the things, that's the big thing this year, you're going to hear me touting from the podium and through my Twitter feed and other places, is HIPAA-compliant email. It's a big deal.
And it is, and you and I talked a little bit about this ahead of time, that HIPAA is not something fun to talk about. It's not something dentists really want to chat about, and yet you can't just stick your head in the sand and say, oh well. I mean, this is some important stuff. Like you said, if you wouldn't do it with a credit card, you wouldn't do it with radiographs either. Yeah,
and it's one of those things. One of my friends is Dr. Dan Fisher, who's the guy that owns UltraDent. And I love that he has a thing, he calls it the daughter test. And he says, if you're going to do treatment, if I wouldn't do it to my daughter, then I shouldn't do it to any other patient. And I think that kind of stands up with this. If you wouldn't take your, whoever, insert whatever loved one here, if you wouldn't send their information, out over the internet, then don't send your patient's information either.
Good information as always, John. Hey, and wanted to make sure that I plug also, John did a great article on the top 10 tech trends heading into 2014. You can find that on dentalproductsreport.com. Great article, good look into what dentists and dental team members can be expecting as far as technology in 2014. So, John, as always, man, I really appreciate the time, and thank you for sharing your knowledge with our readers.
Hey, Kevin, anytime, I've wanted to be a dentist since I was 3 years old, and it's a passion of mine. And so the way I look at things is, if I get a chance to go to my office and I can change somebody's life for the better, I mean, that's just the greatest feeling in the whole world. And one of the things I really love about my relationship with Dental Products Report is the idea that, okay, rather than now just changing, the lives of maybe the 10 people I might see on Monday, now I get a chance to change the lives of patients and doctors, everybody's patients and doctors on Monday, and that's a great feeling. It's something I really treasure.
That's cool. Well, we love having you on board, man, and looking forward to great things in 2014.
Absolutely, man. It's going to be a great year, and it just keeps getting better.
Absolutely. All right, my friend. Thanks so much. Take care.
Thank you, Kevin.